Continuing this fascinating discussion with Dr. Pillsbury, preventative medicine will be incentivized by this new legislation.
That's correct, because actually the law is that there are no deductibles and so forth in new plans come up and in the Medicare. So that will encourage people to get their preventive care, which should make things much better.
And I noticed from reading your article that healthy living can enormously reduce the cost of health care to the country. And you mentioned obesity as a almost epidemic problem these days.
Well, that's one of the problems with actually having the emergency room as a fallback position for a healthcare system. You know, you can't possibly, deal with these chronic conditions by episodic visits to the emergency room. And obesity is actually at epidemic proportions. Something like, 40% of the people are overweight and 30% are obese. And 60% of the cases of adult onset diabetes are in people who are obese.
So if we could get people to live healthier, it would be a tremendous reduction in the total health care cost to the community.
For those of you who haven't seen Jamie Oliver, I suggest you tune into his show. He gave a great lecture down in the convention center a few months ago. That was terrific and inspiring, a different way of looking at this thing. But it could be that the current generation of obese people are not going to live as long as their
So Big Mac is not the way to go.
Big Mac is not the way to
Okay,
go. Well, once in a while, maybe, Mark.
There are continuing problems even with the new health care legislation, and one that you've identified, Doctor, is no advance direction vis-a-vis end-of-life illness. Explain.
Well, this actually was a casualty of the terrible discussions that went on while the bill was being discussed. And in an attempt, I guess, to defeat the whole thing, why people had termed death panels, which were actually in the bill, was actually payment for physicians in their offices to help the patients actually develop advanced directives. Now, an advanced directive is something I hope every one of you viewers has, because it tells your healthcare providers what you want to have done at the end of your life. Unfortunately, we all end up the same way, and at some point in time, we'll reach that. Some die quickly, but some have lingering diseases, some have sudden comas, and if the healthcare workers don't know what to do, we have to do everything. And so we have a huge ICU, probably 61 beds, and we have patients that are brought in all the time from nursing homes and so forth in comas, where the family doesn't know what to do. Some members of the family say, do everything. Others will say, no, you didn't want that, but if it's not written down, it's very difficult. So you should meet with
your family well in advance of getting into this situation and tell them what you want them to do if you should be in a terrible accident or incapacitated.
That's right, and of course we ask everybody when they come into the hospital, only 25% of people entering our hospital have advanced directives. We ask them when they come in, do you have an advanced directive? Do you want to make one? And of course, that's not the time to do it, because people come to the hospital to get cured, not to die. But doctors would like to do this in their office, but currently they don't get paid for it, and they're so busy, the primary care doctors, that they don't do it, and so it doesn't get done. Now you can get it offline. If you go to 5 Wishes, online is a free sample of an advanced directive. You can fill it out yourself. And
let me just add to that, you might consider organ donation if you are willing to donate your organs in the event of a tragic incident or injury. A dear friend of mine was the successful recipient of a heart transplant through an organ donor, and you can provide life to someone else.
All right, absolutely.
Well, Doctor, you've been in distinguished practice for 40 years. For the last 5 years, you've been in medical administration. Look back and tell us about your career in medicine. Satisfying?
Well, I joined my father in 1964. He was the first obstetrician to practice in Long Beach in 1927, and it was a great privilege to have practiced with him. I learned a lot from Dad. And it's been my very great privilege and honor to have had patients in Long Beach. Some of you perhaps looking in remember the time when maybe I helped deliver your baby or took care of some other things. And what an honor that is and privilege to have served people. It just gives me a tremendously fulfilling, lifetime. About 10 years ago, I decided I delivered enough babies, and so I kind of tried to find something else to do and got into this medical administration thing. But I look now on the other side of the coin and find that medical administrators are actually very committed to actually healthcare too. And one of the challenges in the future is for doctors and hospitals to work better together.
Yes.
And to align our interests. And that's one of our strategic goals in our system is to actually, do that and promote that.
And doctors want to do the right thing,
do the
and
right
yet
thing.
the system sometimes, as you were mentioning earlier, pushes them to do tests they really don't want to do, but they feel they need to under the system. And so the changes in the law can be helpful in that respect.
Well, yes, but not quite enough, because you touched on something, because a lot of people actually downplay the importance of tort reform in this new law. And the new law is inadequate in actually providing funding for an improved form of tort reform. Everybody talks about this as, it's only 10% of the cost. Well, it's a huge impact beyond that. That's why the emergency room costs so much more, because those doctors don't have any relationship with the patient, and to get just a slight incremental increase in accuracy of the diagnosis, they do more tests.
As an attorney, let me call it what it is. Defensive medicine is having a lot of tests that are not medically needed, but in the back of your mind, the doctor's thinking, I don't want to be sued, and I don't want to be sued successfully, so I better do all these things to protect against a lawsuit. And the suggestion of tort reform is the law should be changed a bit to eliminate some of these frivolous suits.
Well, that's right. And it has a bigger impact than that, because in my specialty of OBGYN, for example,
Yes.
now across the country,
Yes.
48% of men, OBGYNs, give up obstetrics at age 48. Now, it's an incredible number. And women at age 38. So they've only been out of practice in less than 10 years. That was when I was just hitting my stride. So what's going to happen with it? That's going to be a workforce issue, I'm afraid, if things aren't.
We'll come back. I have a little story on that issue. Please stay with us. We'll be right back with the remaining portions of Straight Talk.
Welcome to McKenna's on the Bay, where fine dining is complemented with a breathtaking view. McKenna's is a restaurant of incredible ambiance, providing service and cuisine with style, class, and romance. The menu offers a variety of appetizers, serious seafood, prime steaks, an oyster bar, and specialty entrees for either lunch or dinner. McKenna's on the Bay features patio dining, nightly entertainment, and 2 banquet facilities. No matter what your occasion, McKenna's on the Bay is like being on vacation. Join us today at McKenna's on the Bay.
Founded in 1976, Polly's Gourmet Coffee is Southern California's most complete gourmet coffee store. Polly's has the best tasting coffee, freshly roasted every day right in the store, plus a wide selection of teas, an in-house bakery, espresso bar, patio dining, and more. We also offer Wi-Fi, free internet access for all of our customers. Our nationwide clientele agree, when it comes to coffee, there's only one name to remember, Polly's, 4606 East 2nd Street, welcoming you into Belmont Shore.
Doctor, picking up on your last point, I was at a wedding several years ago, and my neighbor at the dinner was obstetrics who did high-risk birth deliveries. And where the regular obstetrician couldn't do it, they sent the tough cases to him, and he took some satisfaction. But there was a high mortality rate, as you can imagine, and he was incensed that his insurance carrier told him, don't do certain high-risk cases or we're going to cancel you. And he was outraged that his professional expertise that might save this baby, the insurance company was telling him no.
Well, that's happened around the country. I've been to small towns in Nevada and so forth where the insurance is so expensive that the doctors just don't do OB.
They can't afford
They can't afford to do it. And it's just a ridiculous thing. We should be able to figure out a better way to do it.
Doctor, thank you so much for coming on the show and for all you've done for the community for so many years.
Thank you for having me, Art. It's been a privilege.
Okay, and thank you for joining us. Please be with us next week for the next edition of Straight Talk. Good night, everyone.
Straight Talk has been brought to you by Southern California Edison, the Press Telegram, and Long Beach Magazine. And remember, Straight Talk is viewable worldwide 24/7 at straighttalktv.com.